Hi, I'm Shuai and I'm the class leader of the 2010 batch. I know we have a pathology exam coming soon, so I made this video just to help us in the important key points for our exams. So this time I'm doing inflammation. So for inflammation, we know that there's all different types of classification of inflammation. We can classify it into acute and chronic. Acute, in between acute and chronic, it's subacute and blah blah blah, but that doesn't really matter for the exams. So acute inflammation, we can kind of categorize that into three more. So one is serious inflammation, two is the fibrinosis inflammation, and three is the suppurative inflammation. The serious inflammation is characteristics. It's got it's the smallest increased vascular permeability, which causes an exudation of low protein acellular fluid. So the fluid actually gets into the tissue is actually almost clear, but it's still quite cloudy. A common sites for it is the cavities of the body, a pleura, the pericardium, and the peridermal cavity. Got a picture of that in here. There. Okay. So the second quite important type of inflammation is the fibrinosis inflammation. The permeability of this type of inflammation is larger. So how? So therefore, there's larger, more protein contents that get into the tissues. So, which includes a large amount of fibrin. Okay, so the fibrinosis inflammation actually subcategorizes into three more types. One is the mucosa type, two is the cereal type, and three is the lung, which has got the lower pneumonia. The first one is the characteristics of the mucosa fibrin inflammation. A typical one that we've learned in class is the pseudomembranous inflammation that happens in dysentery infection. So remember we did the pathology of the GI tract, and this is one of the inflammations, the bacillary dysentery of the colon. Okay. The serosa fibrosis inflammation, the common areas of that could be in the pericardium, and I've got some like an example here. This is a fibrosis pericarditis. Now we come to the last type of inflammation, and that is the suppurative inflammation of the purulent inflammation. This is when a large amount of neutrophils and exudates come into the tissue, and this involves like tissue necrosis and formation of pus. So remember the last one is pus, okay? And it could have two different types, well actually three different types. The first is surface purulent inflammation. This occurs in the surface. For example, example of that is the meningitis. Okay. Epidemic meningitis. And another type is phlebotomus inflammation, which happens in the loose connective tissues. And the other type is the abscess. So the abscess is basically purulent inflammation that forms a capsule on the outside. Okay? And now we come to chronic inflammation. Okay, so we did acute and now chronic. Chronic has two types. It's non-specific inflammation or specific. And the specific inflammation contains also two types, and one is the granulomatous inflammation, and one is the, oh God, forgot about this one. One is foreign body granuloma. So the granuloma is inflammation. It's a typical example of that is TB. And foreign body granuloma, a typical example of that is lifts, like stitches, linings like in the skin. Hopefully that will help. But see ya.